Imagine living with type 2 diabetes where daily injections and constant monitoring are part of your routine. But you could also picture a world where managing your condition is as simple and painless as applying a small patch to your skin. This is the vision of George Cheng, a high school student from Cary, North Carolina, inspired by his own mother and sister who both have type 2 diabetes. George embarked on a mission to create a revolutionary new treatment. Welcome to the story of DiaMiR. DiaMiR is an innovative microneedle patch designed to revolutionize type 2 diabetes management.
And my project is on DiaMiR, a microRNA miR-23 microneedle patch for type 2 diabetes control.
Developed by George Cheng at the North Carolina School of Science and Mathematics, this groundbreaking project utilizes microRNA technology to offer a more effective and less invasive treatment for millions of diabetics worldwide.
Currently, 462 million people around the world have type 2 diabetes, which can lead to a lot of health complications. Current solutions for type 2 diabetes aren't so great at all. For example, there are the insulin pump and the insulin needle, both of which are expensive and invasive.
To understand the revolutionary potential of DiaMiR, let's delve into the detailed development process that George undertook.
I sought to create a microneedle patch that targets relevant organs and is both painless and affordable.
George's journey began with an extensive review of scientific literature to identify the most promising microRNA for diabetes control. After thorough research,
We decided to use miR-23.
Studies led him to choose specific cell lines for testing: HepG2 liver cells, L6 skeletal muscle cells, and 323L1 fat cells.
With our methodologies planned, we moved on to our first experimentation, which is literature validation.
George conducted in vitro experiments to test miR-23's efficacy.
Afterwards, we moved on to our cell line experiments, in which we found that miR-23 significantly decreases glucose output and increases glucose uptake.
He discovered that miR-23 significantly decreased glucose output in liver cells while increasing glucose uptake in skeletal muscle and fat cells. These results were promising indicators of miR-23's potential to manage blood sugar levels effectively.
With our in vitro trials done, we moved on to fabricating DiaMiR itself.
By cross-linking the microneedles and incorporating miR-23, he ensured a slow, steady release of the microRNA. This step was crucial to maintain the patch's effectiveness over several days.
Afterwards, we measured the morphology of DiaMiR by capturing its SEM and fluorescent images.
Scanning electron microscope and fluorescence imaging confirmed the structural integrity and proper loading of the microneedles.
Then came our biggest obstacle, in vivo trials. After contacting 50 institutions, I finally met Dr. Huang from North Carolina State University.
Together, they applied DiaMiR patches to diabetic mice over a 10-day trial period. These in vivo tests were essential to observe the patch's real-world efficacy and safety. The results of each phase of George's research were both promising and groundbreaking. In the in vitro results, the laboratory tests showed that miR-23 could effectively manage glucose levels. In liver cells, it reduced glucose output, while in skeletal muscle and fat cells, it inspired glucose uptake. These findings validated miR-23's potential as a therapeutic agent for diabetes management. In vivo results, the trials on diabetic mice yielded even more promising results.
We found that DiaMiR significantly reduces the blood glucose of type 2 diabetic mice.
Mice treated with DiaMiR patches showed a significant reduction in blood glucose level and HbA1c, a marker for long-term blood sugar control.
We also saw in our HbA1c experimentation that DiaMiR had long-term benefits, as it reduces the HbA1c level in type 2 diabetic mice significantly.
Importantly, further tests confirmed that DiaMiR patches were non-toxic with no adverse effects on liver or kidney function.
We were able to take skin biopsies and run DiaMiR through multiple biomarkers like ALT, AST, albumin, amylase, and urea nitrogen to determine that DiaMiR is not toxic.
The successful development of DiaMiR represents a significant advancement in diabetes treatment. For patients, this innovation means a more convenient, painless, and cost-effective alternative to daily insulin injections.
In this study, we not only examined the correlatory effects of miR-23 on type 2 diabetes, but we also examined the miR-23's effect on multiple cell lines as well as animal models in vivo.
By reducing the frequency of injections and the risk of hypoglycemia, DiaMiR can dramatically improve the quality of life for millions of diabetics. DiaMiR has the potential to transform diabetes care globally. Its minimally invasive and highly effective design offers a promising solution to one of the world's most prevalent chronic conditions.
The ultimate goal for DiaMiR is for it to be used by my mother and my sister, as well as 462 million other type 2 diabetics around the world.
George Cheng's work exemplifies how innovative research and dedication can pave the way for medical breakthroughs, inspiring for a future where diabetes management is simpler and more effective.